Did you know that 1 in every 2 men over the age of 50 faces some kind of prostate issue? It's a surprising statistic, and one that most men ignore until the symptoms become too uncomfortable to bear. The truth is, prostate problems often creep in silently, bringing with them urinary troubles, pelvic discomfort, and in some cases, serious health risks. And the earlier you take action, the better your chances of living symptom-free. I'm Dr. Isabel Lopez, a urologist specialized in prostate health for over 25 years. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. Today, we're diving into a topic that every man over 40 should take seriously: how to protect your prostate with simple home exercises that make a real difference. The prostate is a small gland, but its role in male health is anything but minor. When it swells or becomes inflamed, it presses against the bladder and urethra, leading to weak urine flow, frequent trips to the bathroom, and even pain. The good news: there are natural ways to ease these symptoms, and exercise is one of the most effective. In this video, you'll discover 5 practical exercises that can be done in the comfort of your home. No equipment, no gym, no excuses. Each movement is designed to increase circulation, strengthen critical muscles, and improve bladder control. You don't need to be in perfect shape to start. Just a few minutes a day can set you on the right path. We'll begin by understanding the most common prostate problems men face, and why prevention is key. Then, I'll guide you step by step through each exercise with simple instructions and direct benefits. This isn't about complex routines or trendy workouts. This is about giving your body exactly what it needs to stay strong and healthy where it matters most. So if you're ready to take control of your health with simple, science-backed methods, follow the channel. Let's move on to what these prostate issues actually look like and why ignoring them isn't an option. When men think about prostate issues, most immediately associate them with aging. And while it's true that age increases the risk, it's the lack of awareness and early action that often turns a manageable condition into a persistent struggle. Among the most common problems is benign prostatic hyperplasia, BPH, an enlargement of the prostate that's not cancerous but still highly disruptive to daily life. BPH causes the prostate to press against the urethra, making it harder to empty the bladder fully. This leads to frequent urination, especially at night, a weak urine stream, and the constant feeling that the bladder is never truly empty. Many men accept these symptoms as normal, but they are not. They are signs your body is asking for help. In addition to BPH, prostatitis, or inflammation of the prostate, is another common issue. This condition can result in pelvic pain, burning sensations when urinating, and even sexual discomfort. Often caused by infection or prolonged sitting, prostatitis is frustrating and sometimes difficult to diagnose without proper medical attention. Then there's the silent threat: prostate cancer. While it's not the focus of this video, it's important to note that many of its early signs can mimic the symptoms of BPH or inflammation. That's why prevention and early intervention through lifestyle habits, including exercise, are so crucial. Small changes can reduce risks and improve your quality of life. The real danger lies not in the symptoms themselves, but in the tendency to ignore or normalize them. A man who wakes up 3 times a night to urinate may think it's just part of aging, but it's not. It's a sign that your prostate might be sending signals, and it's time to respond with action. And that's exactly where movement comes in. In the next topic, we'll explore why targeted exercises can support your prostate health by improving circulation, reducing inflammation, and strengthening muscles that control the bladder. You'll see how each movement works to counteract the effects of these common issues naturally and effectively. Most men don't associate exercise with prostate health, but they should. Regular movement does far more than build muscle or burn calories. It directly impacts the pelvic region, where the prostate sits, by boosting blood flow, reducing pressure, and stimulating healing processes that medication alone can't replicate. This is why even simple, daily exercises can make a big difference. The first major benefit is increased circulation. When the pelvic area gets more oxygen-rich blood, it helps flush out toxins, reduce inflammation, and promote tissue health. Poor circulation can lead to stiffness, swelling, and a buildup of tension around the prostate, especially for men who sit for long hours. Movement breaks that cycle. Then there's the role of the pelvic floor muscles, a group of muscles most men have never even heard of. These are the muscles that support the bladder, bowel, and yes, the prostate. When they are strong, they provide better control over urination, reduce leakage, and help relieve pressure in the pelvic region. Targeted exercises keep them firm and responsive. Exercise also reduces stress, a critical but underestimated factor in prostate health. Chronic stress increases levels of cortisol and inflammation, both of which can worsen urinary symptoms and irritate the prostate. Just 10 minutes of intentional movement a day can shift your nervous system out of fight or flight and into repair mode. There's also the hormonal balance factor. Regular physical activity helps regulate testosterone and reduce excess estrogen, two hormones that play a role in prostate enlargement. A balanced endocrine system supports not only prostate function but also sexual health, energy levels, and overall vitality. So while pills and supplements can help, they don't replace the power of movement. The key is knowing which exercises to do and how to do them right. That's where the next segment begins. We'll start with one of the most effective and accessible moves, the pelvic bridge, which directly activates the muscles surrounding the prostate. The pelvic bridge is one of the most powerful yet underrated exercises for prostate health. It targets the glutes, lower back, core, and most importantly, the pelvic floor muscles, those deep stabilizers responsible for bladder control and internal support. You don't need a gym, just a mat or carpeted floor and a few quiet minutes. Start by lying flat on your back with your knees bent and your feet flat on the ground, hip-width apart. Place your arms by your sides, palms down. Slowly lift your hips off the floor, pressing through your heels until your knees, hips, and shoulders form a straight line. Hold the top position for 2 to 3 seconds, then lower your hips gently back down. Repeat this movement 10 to 12 times, focusing on controlled breathing and full engagement of the glute and pelvic muscles. Don't rush through it. The quality of the movement is more important than speed. You should feel a firm contraction in your core and hips, not strain in your lower back. That's how you know you're doing it right. This exercise boosts blood flow to the pelvic region, activates the stabilizing muscles around the prostate, and strengthens the foundation that supports the bladder. It also encourages spinal alignment and eases pressure in the lower back, an area that often compensates when the pelvic floor is weak. To enhance the effectiveness, try exhaling as you lift and inhaling as you lower your hips. This breathing rhythm activates your deep core, creating a natural massage for the internal organs and improving oxygen delivery to inflamed or sluggish areas. Over time, you may notice improved bladder control and a greater sense of stability in the pelvis. Join the Members Club and leave a super like if you find this kind of instruction helpful. Up next, we'll stretch things out a bit with a movement that opens your hips and improves circulation. The butterfly stretch, simple, relaxing, and incredibly effective. The butterfly stretch is a gentle yet highly effective way to open the hips, release pelvic tension, and stimulate blood flow around the prostate. It's particularly helpful for men who sit for long periods, whether at a desk, in the car, or watching TV, as it counters the compression that restricts circulation in the lower body. To begin, sit on the floor with your spine tall and shoulders relaxed. Bring the soles of your feet together, allowing your knees to fall open naturally to the sides. Hold your feet with your hands and keep your heels as close to your body as is comfortable. From here, gently press your knees downward using your elbows or just gravity. Never force the movement. Hold the stretch for 20 to 30 seconds, breathing deeply and steadily. You should feel a light pull in your inner thighs and groin area. If you're tighter, your knees may stay high at first, no problem. Over time, as flexibility improves, they'll begin to drop lower. The key is consistency, not perfection. This stretch directly improves pelvic flexibility, a crucial factor in maintaining smooth circulation to the prostate and bladder. Tension in the inner thighs and groin can restrict vital blood vessels, making it harder for your body to flush out inflammation and nourish the area. The butterfly stretch helps reverse that blockage. It also supports hip mobility, which is essential for posture, spinal alignment, and lower back health. When the hips move freely, the pelvis can tilt and shift naturally during walking and sitting, relieving internal pressure and promoting comfort. The result: less strain on the prostate and smoother urinary flow. Stay consistent with this stretch, especially in the morning or before bed. In our next movement, we'll shift to a classic yoga exercise that brings mobility and relief to the spine and pelvis, the cat-cow stretch, a fluid motion with powerful effects. The cat-cow stretch, borrowed from yoga practice, is more than just a spine mobilizer. It's a dynamic way to improve circulation, ease pelvic tension, and support overall prostate health. Gentle and rhythmic, it invites movement into areas that tend to stiffen with age and inactivity, especially the lower back and pelvic region. Start on all fours, with your hands directly under your shoulders and your knees under your hips. Inhale deeply as you arch your back, lifting your tailbone and head toward the ceiling. This is the cow position. Then, exhale slowly as you round your spine, tucking your pelvis and chin. This is the cat position. Move fluidly between the two. Repeat this cycle 10 to 15 times, syncing your breath with each movement. Focus on spinal mobility and pelvic engagement. You're not just moving your back, you're also massaging the deep internal muscles that connect to the bladder, intestines, and prostate, promoting healing and flexibility from within. What makes this stretch powerful for prostate health is its ability to release tension in the lumbar spine, which often compresses the pelvic nerves. When the lower back is tight, it can create a chain reaction of stiffness and poor blood flow in the pelvic region. Cat-cow gently undoes this, restoring fluidity and relaxation. It also enhances the neuromuscular connection between your brain and the pelvic floor. By moving the pelvis rhythmically, you're training your body to respond better under pressure, especially during moments of urgency or discomfort. This improves urinary control and overall pelvic stability. As you continue this practice, you may notice improvements not just in urination, but also in digestion, posture, and even sleep quality. And we're not done yet. Up next is a powerful, isometric move that builds endurance and strength in the lower body. The wall sit, a simple hold with major benefits. The wall sit may look simple, but it's a powerhouse exercise when it comes to building strength and endurance in the lower body and pelvic region. Unlike dynamic movements, this isometric hold trains your muscles to support pressure without moving, an essential function when managing bladder control and reducing pressure on the prostate. To perform it, stand with your back flat against a wall and your feet shoulder-width apart, about 2 feet away from the wall. Slowly slide your back down until your knees are bent at a 90-degree angle, as if sitting on an invisible chair. Keep your shoulders relaxed and your core engaged. Hold this position for 20 to 30 seconds. You'll feel your quadriceps, glutes, and lower core working hard to stabilize your body. These muscle groups are directly connected to the pelvis and help support proper alignment of the spine and bladder. The stronger they are, the less strain is placed on your internal organs, including the prostate. What makes the wall sit especially useful is the way it trains muscular endurance. A weak lower body can lead to instability in the hips and pelvis, which may increase the pressure placed on the prostate during daily activities like standing, walking, or even using the restroom. This exercise helps build the stamina needed to maintain pelvic support throughout the day. It's also an excellent option for men who prefer low-impact training. There's no jumping or fast movement involved, just steady pressure and controlled breathing. Focus on keeping your knees in line with your ankles and avoiding any forward tilt of the pelvis. The goal is full-body stillness with deep internal activation. Once you've built up strength, you can increase the hold time or repeat the exercise in sets. Now that your legs and core are engaged, let's move on to the most targeted movement for bladder control and prostate support, the Kegel exercise, an internal workout with visible results. Kegel exercises are the cornerstone of pelvic health, especially for men dealing with prostate issues like BPH or post-surgical recovery. While often associated with women, Kegels are just as critical for men. They directly strengthen the pelvic floor muscles that support the bladder, prostate, and rectum. And the best part, you can do them anywhere, anytime. To begin, imagine the feeling of trying to stop the flow of urine midstream. That gentle contraction you feel, that's your pelvic floor. Now, sitting or lying down comfortably, contract those same muscles without tensing your abdomen, thighs, or buttocks. Hold the contraction for 5 seconds, then release slowly and rest for 5 seconds. Repeat this cycle 10 times, focusing on control and isolation. Avoid holding your breath or squeezing other muscles. This may seem easy at first, but proper technique requires practice and patience. Over time, your ability to hold and relax will improve, and with it, your urinary control and internal stability. Kegels are especially effective for men with symptoms like dribbling, urgency, or nighttime urination. By strengthening the muscles around the urethra and prostate, these exercises create a protective support system that improves function and reduces pressure in the pelvic cavity. They also play a role in sexual health, improving erection quality and endurance. Many men notice subtle but meaningful improvements in confidence and control within a few weeks of daily practice. The key is consistency. Just like any other form of training, results build over time. Join the members club. Drop a super like, follow the channel, and leave a comment if you've ever tried Kegels before. And don't worry if it feels awkward at first. Most men start exactly the same way. Up next, I'll show you how to put all 5 exercises into a simple daily routine that fits into even the busiest schedule.